Hello, I'm Hugo Rodriguez, Vice Chair of the Levy Senior Center Foundation, and we're happy to welcome you to today's Levy Longevity Program on finding mobility, stability, and balance, presented by Bronte Green. This longevity series is presented in conjunction with Ascension, Illinois, and the City of Evanston. In these sessions, common issues of concern for adults 55 and older will be discussed so we can learn ways to live well and age gracefully. As always, we appreciate your support of the foundation as we continue to work to connect our community of older adults. I'd like to now turn things over to our wonderful moderator and partner in organizing these programs from Ascension, Illinois, Sam Cochran. Sam?
Thank you, Hugo. My name is Sam Cochran, and I'm an athletic trainer by trade and the sports medicine liaison in the Chicago metro region with Ascension, Illinois. I'm going to start off by going over some housekeeping items. First of all attendees are muted for the duration of the presentation. Questions may be submitted using the Q&A feature in the bottom center of your screen. Please do not use the raise hand or chat feature or attempt to unmute. We will not be able to hear or see you. Questions will be answered at the end of the presentation during the Q&A portion. Additionally, it is not permitted for this presentation to be recorded by attendees. However, it is being recorded and will be available on the Levy Foundation YouTube channel and website. Lastly, this presentation is intended for information purposes only and is not intended to replace individualized care provided by your respective doctors or practitioners. Ascension, Illinois, and the Levy Foundation are not liable for the misuse of any information presented today. Now I would like to introduce you to our speaker. Today we have Bronte Green with us. Bronte is a physical therapist with Ascension, Illinois, and is the site director for the Evanston and St. Francis locations. Bronte, I now turn it over to you.
Thanks, Sam. Like she said, I'm Bronte. I'm a physical therapist here in the Evanston area. I primarily work in outpatient orthopedics, but I previously worked in an acute care setting, home health, and pediatrics. I love the topic of today's session about aging with grace and what you can do to improve your balance, stability, and your strength as you get older. And I'm happy to answer any questions, like Sam said, at the end. I would, so sorry. Sam, I'm unable to transition to the next screen. Oh, perfect. So I wanted to start off by addressing some common myths that people have in their head prior to initiating exercises. Most people over the 65 are under the understanding that they meet their physical activity requirements, and a part of today's lecture is to give you guidelines of how much you should actually stretch versus work on your balance and your strength per day and per week. I think it's fair to say even those of us who are under 65 probably underestimate how much we do each day. So this will be a good review. Another common myth is that you can't do resistance training with arthritis, and that's just fundamentally incorrect. Arthritic joints tend to be stiff joints, and the best thing that you can do for them is to get them moving so you can build the muscles around them, and we'll talk about that more. High intensity exercise is dangerous for older adults. I would love to argue that a sedentary lifestyle is even more dangerous than trying to get your heart rate up and working a little bit more. Your heart is a muscle like anything else, and it needs to be strengthened in order for us to live well. And you can tell somebody's exercise tolerance without monitoring their vitals. Even if somebody is seemingly well and they seem healthy, it is very important to know what your baseline heart rate is, what your oxygen levels are, and what your blood pressure is. That will guide how intense or the intense of the exercise that you are safely able to do. And we'll go more into how to decide what's appropriate for you in each stage of your life. So why is exercising is important? Evidence suggests that exercises reduce the risk of cardiovascular disease, osteoporosis, and osteopenia, especially since those are bone density related issues. As you do weight bearing exercise, your body will adapt to those demands and it will make your bones stronger. This will help reduce the risk of fractures. This will help reduce the risk of injuries down the road. So if you are osteoporotic, I would strongly suggest getting up and doing weight bearing activities. Don't fear from it. Even if it's in the water, anything is better than nothing. Curing cancer, preventing some cancers, reducing your risk of falls and a cognitive decline. There's also substantial evidence demonstrating that engaging in physical activity has proven to go beyond just your physical health. It can also improve your mental well-being. The benefits of exercises has shown to reduce anxiety, it reduces depression, it increases your self-esteem and just your overall health. It's something that has become an essential part of my life, and it just goes beyond just your physical well-being. And especially going through the pandemic, that is something that I would really love to focus on, is all the benefits of exercising. So exercise guidelines, I pulled from the Mayo Clinic, the American Heart Association, and the CDC. They vary slightly. What I would take away from this is at least 30 minutes of exercise a day is the minimum of what you should be doing. The intensity does vary with duration. So if you are a healthy individual and you are permitted to get your heart rate up a little bit higher, the CDC recommends that you can reduce the duration of your exercise to 75 to 150 minutes because you're still going to get the same benefits. These are all minimum guidelines. If you go above that, there's no risk as long as you've been cleared by a healthcare provider. But I think a good starting point for everybody is to move for at least 30 minutes a day, whether that is strength training, mobility, just stretching, just get your heart rate elevated above your baseline for 30 minutes and we'll start from there. So the first thing that we're going to talk about in depth is mobility. So what is mobility? Mobility is the ability to move your body freely and easily. I know there are many times, especially for those of us who have osteoarthritis, that we wake up first thing in the morning and we feel extremely stiff and we feel extremely achy. So the importance of moving our body through the full range of motion is because synovial fluid gets released when your bones are in that closed pack position. So what do I mean by that? So those of you who have osteoarthritis in your knee, you'll find if you don't move a lot, you'll have a trouble extending it, meaning that it won't go completely straight. If that happens, then the synovial fluid can't get absorbed in the joint surface and it can start to erode. And then that's why you may hear some like clicking or popping, and it's more difficult to move the joint. When you do your stretches, specifically a hamstring stretch or a calf stretch, or if you go to physical therapy and we achieve full extension, that synovial fluid is absorbed and the bone becomes healthier. It's important because you can't strengthen a muscle that doesn't move through its full range. Stretching is one of the most intuitive things that we can do for our body. It's something that even children do without being told. It's why yogis go into that happy baby pose, or we go into full extension when we do a cobra. Your body wants to be able to move. Fish swim, birds fly, people are meant to walk, run, and be active. So the next slide I'm going to talk to you about are some activities that we can do to improve your mobility. So mobility and stretches are safe to do every day of the week. I would suggest starting at 2 or 3 stretches for your upper body and 2 or 3 stretches for your lower body, and make sure they're multi-planier exercises. So what I mean by that is I don't want you just to stretch bending forward or just to stretch bending backwards. It's really important to get some dynamic movement in there. You can rotate your body side to side, pending that you don't have any lumbar restrictions or you're not post-op. But one of my favorite stretches to do in the morning is a traditional just overhead reaching stretch where you stand nice and tall. You grab your wrist in one hand and reach overhead. This is important for being able to reach into cabinets, being able to do your hair, being able to just reach side to side efficiently. And then the same thing with extension. Our bodies and our life is always forward. We're always working on a computer, we're driving, we're watching TV, we're always bent. If we can start working into extension, where if you're standing with your hands on your hips, and even if you just lean your shoulders back slightly, that is a great place to start. And then there's a series of exercises called the McKenzie exercise. That you can progress through if you're working with a physical therapist or a trainer. And then lower body examples would be a hamstring stretch, which I really like because it will benefit your knees and your low back. Your hamstrings attached to your lumbar region. So a lot of times if you're having dull, achy pain in the lower part of your back, if you stretch your hamstrings and if you stretch your piriformis, which is the figure 4 hip stretch, it will help reduce some of that pain and tension that you can feel. And it will also help with your walking mechanics if you can achieve full knee extension. And then the last one that I really like is a lower trunk rotation. So to achieve that, you would lie down on your back, your knees are bent and your feet are flat on the bed, and you just rock your knees side to side. This is a great way to open up the left and right side of your back and get some mobility through your hips as well. I had a couple of questions about attending Tai Chi, yoga, and Pilates, if one was necessarily better than the other. I would say whatever is easily accessible to you and is the best thing. One hasn't been statistically proven to be significantly greater. As long as you're moving your body, that's the best way to go. I will say doing a Tai Chi class once a week, because that was a question that I received earlier, would not be sufficient. It's something that you would want to incorporate daily, even if it's not for a full hour. If you can do 10 to 15 minutes of stretching or active range of motion in the morning or evening, that would be more beneficial than doing a formal class for 60 minutes once a week. So the next topic is balance. This is something that I personally feel very passionate about. It's one of my favorite things to treat in the clinic because of all of the different dimensions you can add into balance. And it just makes it exciting. So what is balance? It's the ability to maintain one's body position over a base of support. It's important to address your balance because the rate of falls for Americans is 1 in 4 every year. So I'm sure most of us know someone in the past 12 months who has fallen, whether it related or resulted in a hip fracture or if they got away relatively unscathed and we were lucky. It's still a very common occurrence in this country, and it's something that can be avoided if we just act intentionally. And I want to give you guys some guidelines in order to reduce your risk for falls. So what can we do? I've broken it down to 5 easy steps to prevent your risk. The first is to exercise consistently, and we'll go through that more in this presentation. But I would say the most important thing is completing an annual physical. You need to know what your limitations are, and getting your blood work done, having a multi-system assessment is the best way to do that. They'll also assess your blood work, and getting this done annually as things can change is the most important. So if you're thinking about starting a new exercise routine and you haven't gone and seen the doctor recently, I would schedule it first before starting on your new routine. You don't want to assume that your fatigue, your shortness of breath, or other symptoms may simply be due to inactivity. You want to rule out other causes first. And then once you are cleared, go ahead and initiate your exercise program. The third step is regularly reviewing your medication list with your doctor. Many of us have a multidisciplinary healthcare system, which is wonderful, but too many cooks in the kitchen can cause problems if we're not all communicating clearly. So it is important, if you are prescribed a new blood pressure medication, that your primary care doctor does know about it, or if your cardiologist has given you something, that your other practitioners are aware, because the way your medications can interact with each other can cause limitations when you start exercising. So whether you talk to your pharmacist or your primary care physician, it is important that everyone knows what you're on currently and how they may interact with each other. The fourth thing I would suggest is annually getting your hearing and your vision checked. Even if you seemingly don't have any hearing or vision issues, this is important to rule out any conditions that may be developing but are not symptomatic yet. So one of the most common causes of balance issues and vertigo issues are what's called BPPV. It's benign proximal positional vertigo. It's when you have crystals in your ear that come out of your semicircular canal. And they don't come out all at once. They'll come out one crystal at a time until too many have spilled. And then when you go to turn your head, your body no longer knows where it is. This is something that can be easily screened for through an ENT if you go to your primary or if you go to your physical therapist. It is not something that I would suggest initially treating at home. But if you do feel like the room is spinning around you, if you have intense symptoms that only last a couple of seconds, that increase with head movements, either looking up, down, side to side, but then resolve in a minute, I wouldn't write it off as just, oh, that was odd and brief episode of vertigo or balance issues. That could be a sign of an inner ear condition that you can go to an ENT or a PT to treat. Just to prevent the onset of a fall or a balance coordination issue. And then keeping your home environment safe. So on our next slide, I have some home safety guidelines to help reduce your risk of falls. The first thing I would suggest, if possible, is to remove rugs. If you have one and you need it for the aesthetic appearance, put a non-slip backing on it to secure it. A lot of times falls will occur in our home when we're not fully awake or in the middle of the night and your foot will catch a rug. So you just want to make sure all the ends and the surfaces are firmly secured to reduce your risk for falls. Reorganizing your cabinet so commonly placed items are waist level or lower. It is much easier to bend down to get something versus reaching up into a high cabinet when we have to go on our tiptoes. When we reduce our base of support from our entire foot to just the ball of our foot, that's when we're at a higher risk for falls. If an item is too high and you do have to stand on a ladder, I would highly suggest getting one with a bar or a handle that you could stabilize yourself with the opposite arm while you're reaching with your dominant arm. I would never use a chair. A lot of times a leg can be wobbly or it could be faulty and it easily falls down. Do indeed use a step stool. I can't tell you how many fractures I've had from patients stepping on inappropriate surfaces trying to reach things overhead. And then placing a lamp by your bed at night or using a nightlight leading to the bathroom. I think most of us know that we use our visual field heavily when we wake up at night and to reduce our risk for falls. And when that's taken away and we're relying strictly on our proprioception, our body system of telling us where we are in space, our balance is severely compromised. So illuminating your path is greatly advised. And then installing grab bars or self-stick straps on the floor of your shower or tub. If you're unsure how to get a grab bar or how to safely get them installed, you can have a home health physical therapist come to your home and make those recommendations. And then you can also talk to your primary care doctor, who can write a script for durable medical equipment and then get it installed for you. Some insurances will pay for that at 100%. Others will have a copay, but it does help reduce the risk for falls, and Medicare will help pay for preventative interventions, including a grab bar. So like I said, you can either get a script from your primary care doctor for durable medical equipment, or you can have a home health physical therapist do an assessment to see what your fall risk is and what equipment that you may need in your house just to prevent injury. So balance training guidelines. So what I would suggest is picking 2 different types of balance exercises. I would do 2 that are static when you're standing still, and then 2 that are dynamic where you're in motion. This, just like mobility, you can do daily because it won't take you very long. Typically, a nice balance routine can take anywhere between 5 to 15 minutes, and you can do it at morning or at night. This is when you can get really creative depending on what your physical activity level are. So some easy balance exercises that you can do standing perfectly still or standing with your feet together. And you can stand on an uneven surface. So sometimes what I'll suggest patients to do is to take their cushion of their sofa off, place it on the floor and stand on that. It's going to make it a little bit more challenging. Or you can stand with your eyes closed to help prevent falls at night when you have to go to the restroom. I would aim for holding each position for roughly 30 seconds and seeing if you can do it 3 times without having to reach out and hold on to a stable surface. If you are at a higher risk, then I would do this under supervision or have somebody standing next to you just to be on the safe side. Heel to toe standing is a classic balance exercise. Those of you who've ever gotten pulled over may have some experience with this, where you had to walk in a straight line with one foot touching the other. But just holding it and making sure you do one set with your right foot in front and the other set with your left foot in front. I will say it is important not to stagger your stance if you want to do heel to toe standing. So what I mean by that is you don't want your feet standing side by side. You do want to make sure you're lined up perfectly. The more narrow your base of support is, the more challenging the exercise is. And again, you can do this on an uneven surface, or you can do it with your eyes closed. Just to make it a little bit more challenging. And then the good old fashioned standing on one foot. What I would suggest while doing all of these exercises is to add in dual tasking. And so dual tasking is the idea of adding a cognitive demand while you're doing a physical activity. So this is especially important for Parkinson's patients who will typically do something, and they go into a freezing behavior, and then they forget what their task is. So a lot of my Parkinson's patients will say they're in the kitchen and they're cooking, and they'll turn their body going to reach for something, and then they will forget what they were going to reach for or how much sugar they needed in this recipe. So what I would challenge you guys to do is, while you're standing on one foot or while you're standing with your heel to toe stance, is to think of different categories. So what I will have my patients do is that I'll have them in a position and I'll say, can you tell me all the names of women that start with the letter A? And they'll have to go down the list for 30 seconds while maintaining their balance. And you'll be surprised with how challenging it is to maintain your physical position while your brain is distracted thinking about a task. You can make it name different types of cookies, different types of cars, clothes that you would wear in each season. It doesn't matter what the topic is, and you can make it more challenging as you progress. some of my favorite examples of dynamic exercises that you can do at home are heel to toe walking. So it's a nice progression of your static position that you were just doing. So you can pretend you're on a tightrope. I would recommend doing this along the side of the couch or along your kitchen counter. That way, if you do need to hold on to something, you can. Or you can create a little obstacle course in your house. If you have cones or hurdles, stepping over something is essential. Getting enough hip flexion and knee flexion to go over an object will help reduce your risk of falls when you're going up and down curbs, when you're getting in and out of the bathtub, or when you're going up and down stairs. So you can always challenge yourself, start off with a 4-inch object and then start making the height a little bit higher. You can do this either going forward, sideways, or even backwards if you get really good at it. And then you can also add in dual tasking while you're performing all these exercises. So if that's naming the birthdays for all of your grandkids, the names of all of your siblings, whatever it may be, pick a category and try to go down a list while you're doing these activities to make that mind-body connection a little bit stronger, and it'll help keep you sharp as you age. And then the third one is bouncing a ball in different stances. So this is fun. You can stand about 5 feet away from a wall. You can have your feet together, heel to toe, or apart, just depending on what your activity level is. And then you can bounce a ball off the wall. That anticipatory reaction is good to help you prevent falls. Or you can pass the ball to a partner if somebody else is nearby and available to help you. And then our next category is strength training. So the frequency for strength training is going to be less than mobility and balance, only to allow for muscle recovery. If you are strength training appropriately, you're going to break down the muscle in order for it to rebuild. And that's why you get so sore and achy. You want that to happen. I would just recommend a rest day in between your sessions, which is why the frequency is a little bit lower. When you're trying to organize your program, I would recommend doing 2 to 3 sets of an exercise and keeping it at 8 to 12 reps. And it's up to you how many exercises you feel comfortable starting off with. If you're intimidated by putting together an exercise program, I would go get your annual, and then you can either meet with a personal trainer or a physical therapist who can help establish a good program for you. You want to target major muscle groups, and you want to work within 70 to 80% of your 1 rep max. A 1 rep max is the heaviest weight that you could lift through a full range of motion once. And then you want to work on the upper end of that. A lot of my patients are scared to lift heavy weight. As long as you're gradually increasing your dosage, it is safe and it is recommended that you start lifting heavier things. You can lift a 20-pound dumbbell. You are most likely picking up your grandkids daily or carrying the groceries, and that can easily get over 20 pounds at a time. So you want to do functional activities in your life. So your exercises should demonstrate and reflect that. So squatting with weight in your hands is great. Lying down and doing a bench press or a bent over row to make it easier for you to retrieve objects from the ground, or even an upright row is perfect. And don't be afraid to load, pending that you don't have any physical impairments that would make it contraindicated. But I would say that most of us underdose our exercises, and you would be surprised with how far you can push your body with a couple of weeks of practice. So why is strengthening so important? Sedentary behavior attributes to more muscle loss than physiological aging process. Inactive adults experience 3 to 8% muscle mass decrease per decade of life. And that doesn't matter how old you are. If you are just working at your office all day, then you come home and you want to sit and relax, completely understandable. But it is important to be mindful that if you don't use it, you'll lose it with your muscle mass. Peak muscle strength loss does occur between years 50 to 70, and that occurs at a higher rate at 15% per decade if we're not intentionally active. And that's why presentations like this are so important, because you don't want to lose your muscle mass. You don't want your bones and your joints to get stiff. So intentionally trying to move at least 30 minutes a day can help prevent all of this. So now I'll open it up for any questions or comments that you guys may have after the presentation. Sam, did anything come through the Q&A?
We did. We have a question about someone experiencing neuropathy and struggling with balance on uneven surfaces, and if you had any suggestions for modifications for the exercises you went over.
So neuropathy greatly depends on what's causing it, whether it's a diabetic onset or if there's another systemic issue going on. This is when I would recommend going to a physical therapist for one-on-one care or talking to your doctor. There are shoes and insoles that you can get that will give you a little bit more support. If you don't have a custom insole, I always recommend my patients going to Fleet Feet. It's Fleet feet. They will scan the bottom of your foot and give you an insole based on if your foot is flat-footed, if you're pronated, or if you have a high arch and you're a little bit more supinated. Having a good insole or a good shoe, which Fleet Feet can provide both, would be one of the better ways that you can combat neuropathy. And then making sure you're doing a skin assessment daily. Make sure there's no like cuts or bruises on the bottom of your foot, especially if you've lost sensation. The ways you'll alter your activities if neuropathy is a concern is if you do it with a partner who can guard you to make sure that you're not going to fall or lose your balance, or doing it by a stable surface. And I would always start small for a shorter duration. I wouldn't start off with 30 seconds. I would maybe start off to 5 and 10 and see how you do.
We have another question asking to review the vertigo, the type of vertigo that's related to inner ear.
Yeah. So there's multiple types of vertigo. The most common one is called benign proximal positional vertigo. It can be easily assessed, but you would need someone else to look at your eyes during the test. So it's not something that you would be able to do at home. You would need a healthcare professional to do it for you. If you specifically want to ask your doctor to perform the test, it's called a DIX, DIX-Hall Pike. And that will determine if you do have BPPV, which is the most common type of vertigo, and they can assess it for your right ear, and then they can assess it for your left ear. Treatment for that type of vertigo will depend on what side it's on, and the frequency of the treatment will be dictated on how long it's been occurring. But it is something that I would recommend going directly to an ENT for, or a PT. I wouldn't necessarily go to your primary care doctor if you suspect that there is an inner ear issue.
Do you have any exercises that should be avoided or are particularly good for anyone with osteoporosis?
Any weight-bearing exercise is advised for osteoporosis, because you want that impact through the bone. Your body will adapt to the demands placed on it, and you want to increase bone density, and that only happens if you're weight bearing through the joint. So in those cases, I wouldn't necessarily recommend swimming or aquatic exercises. That's good for general range of motion. Osteoporosis or osteopenia, I would recommend more Tai Chi, yoga, or Pilates, where you're standing on the joint more.
In regards to the balance exercises, how long do you think someone would adapt or it would start to improve their balance?
That depends on if they have any other pre-existing comorbidities. You should be able to progress your balance exercises between 7 and 10 days. So whether that's increasing the duration from 15 seconds to 45 seconds, or doing the same position with your eyes closed or with your eyes open, I would say if you're doing it consistently between 7 to 10 days, you should be able to progress it in either intensity, duration, or adding an uneven surface.
Is walking considered a weight-bearing exercise?
Walking is considered a weight-bearing exercise. I would suggest walking quickly and walking uphill if you can, just to improve your tolerance and get your heart rate going a little bit more. But it's one of the first recommendations we give patients with low back pain is to get up and moving and walking at least 30 minutes a day.
Other than sit and reach, do you have any other suggestions for hamstring stretches?
Yes. So you can do a standing hamstring stretch. If you're facing your staircase, you can put the heel of your foot on the second stair, stand nice and tall, and then lean forward onto that second step. And that will also give you a nice hamstring stretch in standing. If you prefer to lie down on your back, you can get a yoga strap, or you can use a towel or a belt. Lie down, keep the opposite leg completely straight, put the strap around your foot, and then bring your leg up. It is important, whether you're going to do it seated, standing, or lying down on your back, that you do keep your knee fully extended in order to get the full benefit of the hamstring stretch.
Do you have any other examples of weight-bearing exercises?
Of course. So you can do squats, you can do lunges, you can do deadlifts, you can do yoga or tai chi. Anything where your feet are firmly planted on the ground is considered a weight-bearing exercise. I would typically stay away, like I mentioned before, if you're specifically trying to work on osteopenia or osteoporosis, or if you're trying to improve your bone density, that's when doing exercises in a pool would not be recommended.
Do you have an opinion on an elliptical as a form of exercise?
Your foot never leaves the surface of the elliptical. And that pounding you get when you're walking, that shock absorption is good for increasing bone density. So if I had to choose, I would recommend using a treadmill or walking outside, because that impact is important to improve your bone strength.
Okay, well, thank you very much. That seems to be all the questions that we have at this time. I want to thank everyone for attending today. I hope you found the presentation informative and helpful. Please be on the lookout for the follow-up email that will include a recap and information on additional resources, as well as a feedback survey. Thanks again, and we look forward to seeing you at the next Levy Longevity Series presented by Ascension, Illinois.